Welcome to Billings Clinic Health Magazine. I'm Leslie Blair, and joining me today are two physicians from the Billings Clinic, Dr. Mark Piedra from Neurosurgery and Dr. John Schallenkamp, who is the chair of radiation oncology. Welcome, fellows.
Thanks for having us.
Happy to have you here. We are going to be talking about the Gamma knife, which is a new high-tech procedure that we're able to deliver many life-saving and life-enhancing treatments through, and we're going to be talking about that. Has to do with cancer and other functional disorders. So a little brief introduction of both of you. We'll start with you, Dr. Schallenkamp. You've been around for a little bit longer, I think, than Dr. Piedra. Tell us about your background.
Yeah. I came to Billings about 9 years ago, so came from Mayo Clinic, and we've had a lot of support from the community and the clinic, and I think we've been luckily been able to grow a program, and now with the continued addition and finding great other service lines and people like Dr. Piedra here bringing a lot of capabilities to the system, we're able to really work together and bring a lot to the community, and Gamma Knife's one of those pieces.
Well, that's neat. I know you were a big advocate for this device technology, and so you made it happen, and that's exciting. Dr. Piedra, you've been with the clinic now a while. Tell us about your background.
Sure. I came to Billings Clinic in August of last year, 2013. I did medical school at the Mayo Clinic and then my neurosurgery training at the Oregon Health Sciences University in Portland, Oregon. Mm-hmm. And I do general neurosurgery, including the Gamma knife.
What brought you to Billings Clinic?
Well, mostly the team effort, the team approach to care. I was looking for a smaller hospital, unlike the big hospitals I came from out west, mm-hmm. In a nice community where there was a good group of physicians and a good group of neurosurgeons to work with, and found that here in Billings. And in terms of the community, it's been great. You know, it's a nice place to live.
Well, you're making a wonderful contribution. Our community is probably just starting to hear this word Gamma knife, and it's not what it sounds like, is it, Dr. Schallenkamp?
Right. So the gamma part comes from the fact that it really uses radiation, and these are gamma rays. These are high energy X-rays. So that's where the gamma part comes from. And then the knife part is the fact that it addresses some tumors and lesions in the brain, kind of the way a knife would, but without the knife. So there's no mm-hmm. cutting and there's no bleeding, but we do target very specific lesions in the brain, and we ablate them, much as you would attempt to do perhaps with surgery and a knife, but without the knife.
So it's surgery without the knife. Now, you are a surgeon who uses the knife generally.
That's right.
Talk about that. And you, as a neurosurgeon, you operate on the brain and probably the spine.
That's correct. So we do operate on the brain and the spine. The Gamma knife gives us an alternative. So when we have patients that either are unable to undergo traditional surgery under the knife, or where they have a lesion in the brain that might be too dangerous to treat with a traditional surgery, we can treat them with the Gamma knife, surgery, without needing to cut.
Well, that's probably beneficial for the patient then.
Absolutely, absolutely. It makes a huge difference in how quickly they can recover from these procedures, and we are able to treat a wider variety of patients because we can treat patients who wouldn't otherwise be a candidate for any traditional treatment.
Sometimes when you hear cancer, you hear it's a brain tumor and it's inoperable. Is this a case where possibly the Gamma knife could come in?
Yeah, absolutely. This is the cases where we find tumors that we can't operate because they're typically too close to critical structures in the brain. And if we were to operate on them, we may damage those critical structures, leaving the patients debilitated or unable to lead a regular life. And with the Gamma knife, we can sometimes treat them so that we don't injure those structures. And the recovery period from the treatment of Gamma knife is much, much shorter than any traditional surgery. And so they can go back to their regular life very quickly.
That's great. Can both of you kind of describe the process of how it works? how does a patient come to you, and then kind of walk us through that process of actually having that procedure?
Right. So a patient will come to us either from their primary care doctor or from another or whatnot. There'll be a discussion and a referral made, and we'll talk with them, and we'll sort of look at their situation and see if they're a candidate to consider the Gamma Knife treatment. We, at that point, institute this multidisciplinary team, so people aren't sort of left to try and get things accomplished on their own, and where do I go next? So we do have a team approach, like Dr. Piedra was saying. The neurosurgeon and the radiation oncologist, we want to see the patient and their family, want to talk to them and give them some expectation of what the process would be like. We have a nurse navigator who will be also part of that team and make sure we're kind of connecting the dots and no one's left behind. We'll be able to, as a team, also review the particular case, make sure we all kind of agree that this is the best treatment approach for this patient. And then we'll start sort of the scheduling piece. And the scheduling is really, when can they come? And it's kind of start the day early in the morning to make sure we get them in the we have a localizer frame that helps us be extremely accurate with the treatment.
And that's kind of the halo that goes on the head? Exactly.
It's like a halo. And again, sometimes people worry about the halo, but it's actually a great thing to have, because it's your brain. I mean, this is your brain. And so, sometimes if we try and do these treatments without the halo, you start to lose accuracy. And if we're trying to use a technology to minimize side effects, every little micron, every little millimeter counts. So that halo really helps us with accuracy and sparing any damage. So we come in, and the neurosurgeon team, they get that halo on, and we're there, and then we use a sort of a high-tech MRI to really get a nice look inside the brain, and so we can target that spot where we need to treat very accurately. The patient comes over to the radiation department with us, and that's where we have the actual device, and together we get to work on creating that plan, so the Gamma Knife knows where we're going to be placing the radiation shots. We call them shots. Sometimes you do more than one little location and create a very nice tight treatment. And once the group creates that plan, it goes through a quality assurance process quickly with our medical physicists, and then we start the treatment. And once the treatment's finished, then we just get them there's like a little bed they lay on for the treatment. We get them off that, and we get the halo frame off, put maybe a couple Band-Aids on, and they're ready to go home.
So they can get up and walk.
Yep, absolutely.
That's great. How long does the procedure, once they lie down in the device, how long can that take, or does that take typically?
It's it varies a bit. Location, number of spots we treat, maybe the size. It can be as little as 15 minutes. It can take over an hour. It just kind of depends on the complexity. Of course, another nice feature, again, because you have that halo system and it's very accurate, is if someone's tired and maybe they need to go to the bathroom or something like that, we just hit the pause button. We can get them up and do what we need to do, and when we're ready to start again, we can lay them back down.
And the treatment itself has no pain. There's nothing that the patient feels during the treatment except for movement of the bed, and even that is very slight. And essentially, they're just lying down. We have patients who sleep through the entire thing. They don't even notice it until we wake them up to say, "It's done. Let's go home." And that's it. So.
That's great. Talk about your team. I know you talked about the players, but there is the physicist plays a big role, and I think these guys are probably pretty sharp guys that can figure out all of this math of where things go.
Yep. They're PhD physicists who help with managing the dose of radiation that they're receiving, that the patient's receiving, as well as the accuracy of the treatment that we're providing. So the two physicians, the radiation oncologist like Dr. Schallenkamp and the neurosurgeon like myself, we create the plan, the treatment plan, and then that treatment plan is verified by the physicist to ensure that the Gamma Knife machine will deliver the exact dose that we prescribed, that we decided on, in the exact area, the exact part of the lesion in the brain that we're treating. I don't know if you have more to add to that, but.
I think you're right, and you're also right. I mean, these are highly trained people, very specialized in what they do. So they, again, it's all about quality and safety. I mean, that's the key. So it's one thing to think you're delivering radiation like this. Again, in the brain, that's important.
Yeah.
So it's one thing to think you're doing it, but it's another thing to make sure the machine is going to do what you think it is, and that's their job. So they're absolutely critical in the process.
Now, between the radiation oncologist and the neurosurgeon, how do your responsibilities and areas of expertise, how do you interact?
Well, you know, we interact by deciding on what we think is the appropriate treatment dose of radiation and the appropriate areas. And we really have they overlap almost completely. Sure. I have a little more experience because I treat I do open surgery in the brain, so I know what parts of the brain are most sensitive to, for example, over-treatment or treating too much in that area. So I kind of help with that decision. Dr. Schallenkamp expertise is in radiation delivery. It's what he does every day for his role in providing care, and so our knowledge is overlapped quite a bit.
Exactly.
So you get a team of brainiacs working on a brain.
Yeah.
And we have a female radiation oncologist that's part of the team as well. Talk about all the physicians who are trained now to work in this area.
So the physicians who are on the team include all of our neurosurgeons. So Dr. Dolan, Dr. Lopez-Gonzalez, Dr. Piedra, and we have myself, and Dr. Goulet, Michelle Proper is our first female radiation oncologist, and we have another female radiation oncologist coming, Dr. Brianne Terakidis, will be coming in September, and she also has extensive experience with gamma knife.
And then the medical physicists?
We have two medical physicists, Dr. Dennis Cheek, and we have Chris Veal, and they've both been credentialed, and they've done a lot of work. They're very experienced.
Now, I know you had to go through special training to be able to operate the gamma knife and to know how it works and so on. How did that go, or where did you go for that?
Yeah, I trained in Pittsburgh for the gamma knife treatment, and the advantage of that is that is the site that's had the most experience. They've been doing gamma knife radiosurgery like this for 30 years.
Really?
The neurosurgeons and radiation oncologists that operate the units that they have there at the University of Pittsburgh have been the leaders in the field. And so not only do we got the training from those experts, but also the contacts that if there are questions about what's the best way to treat this patient, we have that connection now to contact them, and they're more than willing to help us out in that regard. And then the experience is all there. The gamma knife treatment itself, though new to Billings, has been around for quite a while now, and that record it has, a historical record of successfully treating patients, is to our advantage because we're just following on all that history, and it's not like we're doing some new things, even though the device may be new to Billings. The technology or the technology is quite new actually as well, but the idea, the approach that the gamma knife takes has been around and has quite a history.
That's good to know. I didn't realize it had that long history.
It's interesting, and this was a neurosurgeon who developed this idea of this stereotactic way of approaching, a lesion inside the brain, how to be very precise. It was Lars Lexell, and that first unit was I think 1967. So over time, there's iterations of this device and how much, just in terms of efficiency and safety, all the improvements in what we have today. The perfection system, the gamma knife perfection system, is just basically the best there's been. I'll add a little bit to the training aspect to it. Of course, it's always nice to get a little extra, training before someone starts a program in a location that hasn't had it. Someone who's been to medical school at Mayo Clinic, and those who had training in Mayo Clinic. Mayo Clinic's had a gamma knife program for decades as well, and then we've had a lot of experience in that. And radiosurgery in general can be delivered a few different ways, and we've been doing radiosurgery at Billings Clinic for years. But the issue is the gamma knife takes everything just a step further into excellence. That you just really, you just can't get, because it is the tool, it is the gold standard. And so when the clinic and the surgeons and the neuroradiologist, the neurology team, when all this team comes together and really says we're going to take a step forward and we're going to bring the highest possible level of care to this region, this is the tool that complements it.
And is it correct, this is the only one in a 5-state area?
That's correct.
So it's a big deal. And
Oh,
I
yeah.
know the day you brought it in was a big deal. It's very heavy. And talk about the vault that it has to be in.
Well, so going back to that word gamma, the gamma part of Gamma Knife is the radiation, and of course that needs to have some shielding around it. So,
Sure.
And the nice thing about this particular type of radiation is it's actually relatively easy to shield, and so we do have a vault that it's in, and the walls are lined, and there's no radiation going outside anywhere. But the machine itself has its own internal shielding, which makes it, like you said, very, very heavy. So getting it inside was an interesting feat, but it was nice to see it happen.
I saw you out there with the crane and the big machine. And
Right. I wasn't running the crane.
yeah, that's good. That's not your area of expertise.
Yeah, exactly.
Well, let's talk about the disorders that can be treated with Gamma Knife. Let's start with brain cancer.
Yeah, probably the most commonly treated disease with the Gamma Knife in the history of Gamma Knife is metastatic brain disease. And what we mean by that is cancer that started somewhere else, maybe the lung, maybe the breast, colon, that type of thing, and has spread to the brain. And what the Gamma Knife provides is that we can treat many of those areas, because someone can come up with 10, 15, 20 spots in the brain where cancer has spread to. Traditional surgery, that's untreatable. There's no way to take out 20 spots in the brain and have someone still lead a functional life. So with the Gamma Knife, we can treat all of those at one single session that, they go home the same day, they're back to their regular activities the same day. And it's a huge advantage. And, there's not multiple treatments. There's not returning back and back every day like some of the traditional radiation therapy treatments. And that's probably the most common. The most common and the most treated thing is metastatic brain cancer.
Right. I would say another advantage to that, and my neurosurgery colleagues would, I think, agree that what we avoid when we target a number of metastatic spots in the brain often is that whole brain radiation treatment, which has been very historic, where in the absence of a neuro or radiosurgical way of treating these, you have to treat the entire brain, which has its own potential risks in terms of neurocognitive function and whatnot. So when you have the capability of performing radiosurgery, you're sparing so much of that normal brain that doesn't need the radiation tissue. Now you're minimizing, again, those potential risks. So a patient who has a cancer, and somewhere around 40 to 50% of patients with cancer might have something spread to the brain at some point. So we want to be able to tell them, that is something we should be able to treat. We're starting to enter this era where we should not have an expectation. If you have cancer that spreads to the brain, that should be sort of the end of your life, that we should be able to control that. And that can be a combination of our standard surgery, where you really want to take some of these out, and that's something we always talk about. But if it's the right case for Gamma Knife radiosurgery, we should be able to do that and expect a really excellent control to the areas we treat.
Do you use it to shrink a tumor?
Absolutely. Yeah, so even benign tumors, another type of thing we can treat, meaning tumors that aren't cancer. One of the common brain tumors that come up is something called a meningioma. It's a benign tumor, it's not cancer, but sometimes it's in an area that is not benign, meaning it's in an area that's maybe too dangerous to treat with traditional surgery, or an area or a patient who can't handle or couldn't undergo the surgery because maybe they have other medical issues going on. And we can treat that benign type tumor with Gamma Knife as well. Same thing with a tumor called an acoustic neuroma, which is a benign tumor, meaning it's not cancer, of one of the nerves that goes to the ear. And traditional surgery is available if the patient would like to do that, but has those risks of traditional surgery, meaning injury to adjacent structures, things like hearing loss, facial weakness can happen from those types of surgery, and it's quite common from those kinds of surgery. where with the Gamma knife, the risks are much lower, and they don't have to undergo the traditional surgery by knife, and we can still treat it.
Plus, it would eliminate any chance of infection, I would guess.
Yep. Yep,
Because
exactly.
you're not opening things up.
That's right.
Talk now about other, you talked about benign tumors, and now talk about, that can cause things. Talk about other functional disorders that, through neurology, that can be diagnosed and perhaps treated.
Yeah, so one common one that we see is something called trigeminal neuralgia, also known as tic douloureux. This is a very painful condition of the face. People have lancinating, sharp, electric-like pain into the jaw or the cheek. Sometimes they can't eat or brush their teeth, or even the lightest touch of their face can send them into pain so severe that they're crippled by it. And we can treat that through Gamma knife. There is traditional surgical treatments for that, but that carry the risk that traditional surgical treatments do. And so the Gamma knife offers just another option for patients. The other one that we can offer is treatment for tremor. And there's a couple types of tremor that comes from Parkinson's disease, or tremor that comes just as a what we call benign familial tremor, just tremor that runs in the family. People could have it that's so disabling where they're not responding to medications. We can also treat that with the Gamma knife. We have, again, traditional surgical routes to treat that if the patient wants to go that route, but the Gamma knife offers another option, and that's what we're here to sort of decide and help patients decide on what might be the best option for them.
I don't know if you have experienced this, but if someone has had, like, say, trigeminal nerve operations, and then eventually it comes back, do you know if this is more permanent, or is that proven yet?
It depends. It's not quite proven yet. But the nice thing is it does offer an option even after traditional surgery.
Okay.
So people who have failed traditional treatments for example, trigeminal neuralgia, this facial pain, we can offer another treatment. It's the same with tumors. For example, the benign tumors, sometimes a benign tumor may be treated with traditional surgery, but a little bit needs to be left behind because they can't remove the complete tumor safely. And so we can treat that little bit that's left behind with Gamma knife to prevent that from growing back.
Now, you don't use complete general anesthetic for this procedure, do you?
Completely awake. There's a little bit of anesthetic used for placement of the halo frame, but otherwise the patients are awake the whole time.
Well, that can have its downsides as well. So there are all sorts of pluses.
That's right.
This is great. This is great. Let's go back to if someone's listening and going, oh, this sounds like just the thing for me, what would be the process? They can go to our website, I know.
Yeah, I think there's a few routes. Certainly getting some information about Gamma knife, you can go to Billings Clinic, you can go to the Gamma knife page there, learn a little bit about the process, and there's some information there. And there's some phone numbers, okay? So it's easy enough for people who have some interest to either give us a call, and we can, again, start to work with the nurse navigators and see sort of which route to go and speak with. And if people are in discussion with their referring physicians, whether it's their family doctors or neurologists or whomever that might be, easy enough for a referral to come by. We're happy to talk with people about what their options are.
Yes, because this is so new, we have a robust web page. It's billingsclinic.com/Gamma knife, and people can read a lot of commonly asked questions, and you two had input into that, which we're very grateful for. And then the health line, can call the health line anytime. That's always answered, and they will refer them. They'll either provide some information or refer to one of you to field a question, or the team to get a little more information, and just kind of the whole process. If people already have x-rays, MRIs, that kind of thing, it's helpful to not have to repeat those tests right away to see what's going on with them.
Yes.
Well, that's excellent. I know you're reaching out to our broader community, or broader region, I should say, of the 5-state areas. Have you had any people travel in from outside of the Billings area yet?
Yes, we've had people both come in further treatment, and certainly we've had a number of people come who are sort of in discussion with us right now. And so again, what we've tried to accomplish through the years, and this is another step in that direction, is historically there seems to be this feeling that if there's something serious, then patients in this region feel like they're supposed to go to some other state. And it just doesn't sit right with those of us who really feel like we're trying to bring the best care here, and we don't want people to take on that extra burden of time and travel and all the financial resources it takes. Again, more than happy to talk with people and see if we can keep them here closer to their family. And really, like Dr. Piedra is saying, if it ends up being the right treatment for them, this is pretty quick turnaround to get back to sort of their life. And that's really what we're trying to accomplish.
Well, that's wonderful. I know we tout the Mayo Clinic Care Network, that we have the resources of other physicians, and people can receive that care here through consults with you rather than traveling. But you guys were both trained at Mayo Clinic, so you probably have your own resources that you can call. And now that you've got the connection through Pittsburgh, if you find something unusual or that you need a second opinion on, they can reach out.
That's right.
One of the things that I think is very special for cancer patients is our tumor board. Can you briefly discuss how that works? I think it's just great to know that many people collaborate.
So tumor board is where the physicians bring sort of a patient's case, as it were. We want to discuss the particular aspects of someone's care. And the nice thing about that is this is kind of a big table where everyone reviews the images and the lab data and the patient's history and findings. We have all for instance, the radiation doctors, and we have the surgeons, and we have the chemotherapy doctors, and we have the neuroradiologists and radiologists, and a variety of specialists who are all able to review a case. So instead of a patient having to see 6 or 7 different people, we're reviewing that case together. And so it's a nice way for some peer review, and it's just a way of, and it's kind of another step of safety and quality assurance. Is this idea how we want to step forward and offer someone care? Does that make sense, and is that best practice?
I think that's fabulous. I think it's comforting for the patient and the family to know that many minds went into the decision and that many options were reviewed, because I think people do their own homework. They come in probably with computer printouts and hand them to you, and they know a lot already. And to know that you guys and women have already taken that into account, and this is the recommendation, or you give them the options that they might want to consider.
That's right.
Well, I thank you both for being here today. I know you've got busy schedules, and it worked out great that you could be here. And I encourage our viewers to find out more about Gamma Knife and the possibilities. And you guys are the happiest guys in town because you've got this new toy. You're smiling all the time. That's great. So thank you for joining me today.
Thanks for having us.
Thank you very much.